receiving many calls about long-term disability coverage as it relates to the long-term effects of COVID-19. This is an emerging area. What do we know so far?
Well, Leanne, that's right. I am getting an uptick in calls related to long-term disability claims related to COVID. A lot of people are anticipating concerns. I mean, obviously, this is still in its infancy, but long-term disability can be either physical in nature or psychological in nature, or a combination of the two. And from a physical perspective, I mean, the hope is if you do get COVID that you're done in a couple of weeks and you're back to your old self. But we know there's a small percentage of cases where that's not the case, and there are ongoing respiratory issues, blood clots, and whatnot. So these folks, this may be a burgeoning area where there are long-term disability claims. And then also there are some folks who had other illnesses and conditions who, as a result of COVID, were not able to access medical care. For example, some cancer patients who had their surgeries either postponed or canceled, and that has caused complications. From a psychological perspective, I mean, people maybe who have had COVID who are having troubles dealing with it, or who have psychological conditions as a result, or just people dealing with the stress of living through a pandemic, isolation, fear of health issues, being away from family, friends, or the opposite, being under the same roof with family and friends, this kind of thing. So we do expect that it's going to be a changing landscape for sure, and probably an increase in this type of claim.